May is National Blood Pressure Awareness Month, and high blood pressure can lead to a number of health issues. Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here with the facts. Doc, I know nearly half of the U.S. have been diagnosed with high blood pressure, according to the Centers for Disease Control and Prevention. What are the risk factors for hypertension, or as the average person knows, of high blood pressure?
Yeah, so it's about 47%. And some of the biggest things are the common things that we talk about all the time. It's being overweight, it's diabetes, it's being sedentary or not having a lot of activity, it's smoking, and unfortunately some of it is just familial, right? You have those bad genes. And so 1 out of 4 people are undiagnosed, and 1 out of 3 are diagnosed but aren't on treatment. And I think that's really the key to sort of hone into.
All right, so break down the treatments for people with high blood pressure.
Yeah, so I'm going to run through this, but the important thing is that if you take 100 people, 47 of those people have hypertension. So let's hone in on those. Of those 47, 37 are on medications. Now, unfortunately, of those 37, only about 10 of them actually take their medications and it controls them. The other third, 13.5 actually, take medications and it doesn't control the blood pressure. That's scary. But another 13.5 are not on medications and their blood pressure is not controlled, and that's the scariest group for me.
And talking about scary, what are the consequences if you have high blood pressure but you choose not to treat it?
Yeah, so I think one of the biggest things is a heart attack, right? People talk about having high blood pressure and having a heart attack, stroke. You and I have talked about strokes before. There's vision loss. There's a host of other things. You know, it's funny, when people, especially men, come into my clinic, they talk about erectile dysfunction. And what they don't realize is that having high blood pressure and diabetes can actually lead to erectile dysfunction. This is one of the main reasons that I can get men to stop not paying attention to their blood pressure.
All right, so how do you know, Doc, if you have hypertension?
You know, one of the things about blood pressure specifically, it's a silent killer. You don't know on average until it's too late. Some people have headaches, some people have some chest pain, but most people don't. I would say this, whether you go to a Walgreens, a Costco, a Walmart, when you check that blood pressure and it's 180/20, that's a call to an emergency room or an urgent care. That's not something that you should go home with. However, there's another group of people that have blood pressure above 130/80, and you can see stage 1 and 2. It's concerning. You need to see somebody, but it's not an emergency.
So what can you do to improve your blood pressure?
There's a lot of different things you can do. I think weight loss is key, exercise, the type of food, cutting down on salt, right? But even if you were to do all of those things individually, they only drop your top number, which is called the systolic, by about 5, maybe 10. The real win is when you do all of those. It's called a bundled approach to healthcare. You can drop that top number by up to 30. So if you're at 180 and you do all those things, you get down to 150, you're still going to need medication, but I think it's better than having a stroke.
Anything's better than having
Absolutely.
a stroke or a heart attack. All right, last but not least, some resources for our viewers.
Yeah, it's sort of the same things we've talked about, right? All of the local hospitals have a host of emergency resources or urgent cares. I think El Paso Cardiology Associates I called out specifically because they've been with us after the Damar Hamlin incident, and we've talked about heart disease with them. Whoever your physician or clinician is, talk to them, check your blood pressure regularly. I think those are the keys.
And my cardiologist happens to be with El Paso Cardiology Associates.
Awesome.
ABC 7 medical contributor Dr. Ogechika Alozie, thank you so much.
Thank you, sir.